I would think it would help small business. I have a number of friends that run small businesses that are very successful, but they don't have health care, even for their own families. It's just cost prohibitive. And I tell you, it seems like they're holding their breath every day on whether or not someone in their family is going to turn up with cancer or something. How would these proposals mesh with small business?
Well, in some cases, and again, I'll go back to the House bill, because that's the one that we have the most information about. In some cases, small business would not be affected at all because they would be exempt from having to provide coverage. Some businesses that have payrolls in excess of a certain level, and there's a lot of discussion about what that level should be, would have to provide coverage, but those below that threshold would not. So again, those persons who are employed by those small business or the small business owner themselves could go to that health insurance exchange. And what they would be able to find there, and this is what, right now with an individual coverage, the base underlying concept of insurance is that you're pooling risk, that you're bringing people together so that you can make that risk more insurable and affordable to assure. So the more people that come into that health insurance exchange, the more likely it will be that you'll be able to find affordable coverage there.
Okay. Now, it seems to me that I've heard some things that have been outlandish on health care reform. Can you speak to the whole thing about death panels and euthanasia?
Sure. There are no death panels. They're not in this bill, and I think this is one of the most disturbing characterizations of healthcare reform that we've seen. This goes back to a section of the bill that provides a new Medicare benefit. It provides reimbursement to physicians to provide consultations to their patients about things like living wills and durable powers of attorney for health care, let them know what hospice is, things like that. It has been twisted to mean something completely different. It's a rather innocuous provision in the law that has been really mischaracterized. What we see, and this is something that as I go out and talk to groups, that's one of the first questions I get. Why does AARP support death panels? Obviously we don't. If there were anything like that that was remotely similar to what is being characterized, we would be opposing it, but we can assure you that there's nothing out there like that.
It sounds more like a living will.
Well, and I think the benefit of this is that, for example, I have a living will that says that I don't want heroic measures if I'm in a vegetative state. Now, what I have seen in older individuals as they get closer to end of life is they rethink those things. And what this provision would actually do is provide them an opportunity to have a conversation with their physician so that they can express those desires, whatever they may be, whether they want those life-sustaining measures or not. But it really puts the patient in more control of their end of life than it would without it.
Now, another thing I've heard, which kind of startled me because I thought we just don't do this in this country, and that is public funding of abortions. Is that something that's on the table?
Well, this is a delicate subject with our members. We have members who have strong feelings on both sides of this issue. What we have found, or what we see in the House bill, and this is an amendment that came out of the House Energy and Commerce Committee, is an attempt to kind of thread the needle on this issue and say that there has to be a plan that does not cover abortion. In this health insurance exchange, there has to be at least one plan that does not cover abortion for those individuals who, due to their conscience, do not feel comfortable being part of such a plan. Mm-hmm. On the other hand, there has to be a plan that does for mm-hmm. those who believe that a woman's right to choose is important. Mm-hmm. So it's an attempt by the committee to try to, as I said, thread the needle on this mm-hmm. issue, to try to respect both sides of the argument so that because it's a very a difficult issue mm-hmm. and one that we need to respect all sides.
Certainly. Now, when we talk about this health exchange, health insurance exchange, I've read a lot about insurance companies talking about, well, maybe it'll just outlaw private insurance companies. Is this so?
No, I don't think so. And I guess the source that I go to when I was trying to answer that question, because these are, as these things come up, we need to look at them and see, does this really do this? Mm-hmm. As I looked at that question about private insurance and is this make it illegal, which has been, there's been a number of assertions of that nature out there. I looked at what the Congressional Budget Office estimate says about how many people are likely, and this again goes back to the House plan that does have a public option in it, how many people are likely to be in the public option going back a little farther, today, how many people are uninsured, how many have group insurance, how many have individual private insurance, mm-hmm. how many have government insurance mm-hmm. of some sort, and looking at their projection out 10 years mm-hmm. to see what that's going to look like, and actually the number of people who have private individual coverage doubles. So the Congressional Budget Office, who is kind of the arbiter of all things financial of coming out of Congress, has made the assumption that not only will private insurance survive, it will thrive.